We're with Dr. Esther Hanson, Podiatrist over at Heart and Health, with a couple of questions. And number one, it probably has to be the one you hear all the time. Oh, my aching feet. What's causing this? A lot of people say it's ill-fitting shoes, it's health-related, it's all these other things. 9 out of 10 times, you're the champion foot doctor here at Heart and Health. What's most problem that you see with feet?
Well, it varies, so depending on the patient's medical conditions. Of course, diabetes leads to, like some patients who have diabetic neuropathy, which can cause like aching as far as like pins and needles sensation, burning sensation, as well as numbness. And of course, there are those with skeletal deformities like bunions, hammer toes. People sometimes do wear ill-fitting shoes, which will also cause more pressure, friction, and rubbing on certain areas of the feet. So, there are a variety of things that may cause, pain in the feet as well. And of course, weight gain is another thing, because a lot of times you got to think your feet are taking all the pressure, taking all your weight. So if you do have like a recent weight gain or, for X amount of pounds, so that can cause more pressure and cause pain as well.
Now also there's a thing called a bone spur. Now, those aren't like real spurs, like, with the saddles or something like that. What are they?
Well, sometimes people do get what they call heel spurs a lot of times. For the most part, that's the most common place where people speak about bone spurs. A lot of times that occurs after a patient has plantar fasciitis. The plantar fascia is a ligament that attaches from the heel and it fans out all the way to the ball of the foot. You actually have fibers that run into the toes. So for some people, that particular ligament tightens up. It tightens up and it's not being used, or like you're sleeping for a while and then you get up out of bed, or you've been sitting for a while and you stand up, so you have this tight ligament that abruptly stretches. And that happening chronically, what happens is the ligament ends up pulling the covering of the heel bone called the periosteum, and that ossifies and kind of looks like a little hook. So that's where that particular bone spur occurs. And then sometimes people can get spurring for other areas from arthritic changes, also can cause spurring because it's bone on bone kind of situation.
Now let's go to the younger crowd. Now, sports-related injuries, we see a lot of that with the foot. Now, with the plantar fasciitis, is that from overuse also, or is it from underuse?
Well, it can be from overuse sometimes, because you actually have fibers that are from your Achilles tendon into your plantar fascia. So sometimes overuse from the Achilles tightening up. Sometimes people may get like what they call a tendinosis, or sometimes they may even get like a tendonitis around the Achilles tendon, and that tail can pull on the plantar fascia and tighten it up as well. So with younger patients, of course, making sure that they stretch, especially those in the sports fields, like making sure they stretch before working out during their activity, and also after when the muscles are warm. Sometimes they tend to neglect the stretching aspect of it, but keep that Achilles stretched and mobile will help with plantar fasciitis and things of that nature.
So physical therapy, which we'll be doing later on in the program, that's a big help to some of these ailments, right?
Yes, definitely. Physical therapy is definitely a big help, because they can keep you with the help with the stretching, and other modalities as icing, shockwave therapy, different types of therapies that can help with plantar fasciitis, as well as like Achilles tendonitis or a tight Achilles tendon.
Now, next one is usually with women, feet swelling. Now, this, especially the over 50 crowd, the ankles, and sometimes like they pack their feet into these shoes, and by the end of the day they take off the shoes and boom, boom, boom. What's usually the cause of that?
Well, there are different aspects. Like sometimes patients can have swelling due to what they call venous insufficiency. The veins aren't pushing the blood and the fluid back up towards the heart. So of course, gravity taking its toll, you tend to get swelling after being on your feet and walking for a while. But as far as some of that over 50 crowd, some ladies do experience what they call like fatty deposits around their ankles as well. So that is it's like a benign kind of fatty deposit occurs around the ankle.
Natural part of aging type of thing.
Yeah, being your feet in life,
Women just can't get a break, can they? Because all these other ailments, women especially with the osteoporosis and osteopenia, which is basically the loss of bone and calcium in the body, and then again, your feet are on the bottom, so gravity is always going to be pulling everything down into that direction, right?
Yes, and so we got to take care of our feet. It's very important.
Now, when is the time to see a foot doctor? You know, some people say rest, no rest, you know, work is better. When do you think is the time? If you're having pain for more than a day, or it's extremely bothersome, or you can't walk right, when's the time to see you?
Well, you know, it varies. And of course, with diabetic patients, we recommend them just constantly, constantly seeing a podiatrist just to for evaluation, do your diabetic foot evaluation, just to make sure that, you know, there aren't any new wounds, anything new, you know.
Right.
As far as for different patients, so of course, if you have injury, you know, it's better to see a podiatrist or somebody right away instead of waiting on it. Because you want to maybe send it for x-rays, make sure there's no fractures or any other type of injuries as well. So, you know, of course, patients with ingrown toenails, sometimes they wait too long and then it gets infected and it becomes a little bit more problematic and a little bit more intensive.
And your big toe looks like a watermelon or something, right?
Yes.
Now, also with foot care, going back to diabetic people, you know, our feet take us around all the time. It's not usually something, unless they're giving us a hard time, that we're inspecting or checking. Now, diabetics should really be checking their feet at least once a week, right? Because if they can develop these things, and I think one time when I interviewed you said about ulcers that they can develop on their feet.
Yes, it is, especially those with neuropathy. When the type of neuropathy who has, which they don't feel anything. I usually tell my diabetic patients to get a handheld mirror. So periodically, especially those who have a problem like lifting their leg up, evaluating the bottom of their feet, get a handheld mirror, periodically take a look at the bottom of your feet to notice any changes. You know, of course, I would also tell diabetics to wear white socks, just because, God forbid, if you get a cut or a scrape, you're able to see it with the white socks as opposed to something with a dye. So, you know, it is very important for the diabetics to evaluate their feet and to come to a podiatrist and inform their podiatrist if they notice any changes. Of course, you know, they're at home, they notice things first. And I always tell patients, shake out your shoes before you wear them. Because I've had times which patients, by chance, you may notice, send them for an x-ray, they have a needle in their foot. They have, you know, I had a patient one time had an ulceration because he was walking on something that he didn't, inside his shoe, that he didn't realize until 2 days after, until...
The old expression, having a stone in my shoe, really, you know...
Yes, you know...
Especially if you have neuropathy, which is basically the loss of feeling in the foot, which, you know, is definitely prone to diabetic people, especially those who don't exercise or eat properly, and certainly some of the medications also are going to affect the joints, you know, the side effects with every single medication. But the time to really see the foot doctor, I would say, is what, if chronic, it's not going away within, you know, 24, 48 hours?
Well, if it's an ulceration, if it's a diabetic with an ulcer, as soon as possible. Because what you don't want is for it to get infected, because, of course, diabetics are immunocompromised.
Right.
So, meaning they can get, you know, their white blood cells, they can't fight infections as easily, so it's easier for them to get, you know, end up in the hospital, get, of course, amputations, become septic. So it's very, any type of change like that, they should see their podiatrist as soon as possible. You know, just
so any scrape or anything to us, you know, people who don't have diabetes, we could probably shake it off, it'll be okay, but it could be a real life-threatening problem for diabetic people.
Yes.
And also overweight people, if they're starting to have foot problems, are there corrective measures that can be done for them, you know, besides just losing weight? Because, you know, that's not one of the easiest things to do, especially, you know, for you know, older women, because they have to make sure they have the calcium and the vitamin D to stop the osteopenia, the osteoporosis, which is the, you know, loss of bone. But as you get older, it's foot care is going to be, should be up there with everything else, right?
Yes, you know, it should definitely be, because a lot of times people do neglect their feet. If they only think about it when it hurts, when something hurts, and sometimes, you know, it's late, you know.
Right.
But of course, like, you know, certain people, depending on their foot type, you know, orthotics can be beneficial, making sure they're wearing the proper types of shoes, you know. Sometimes we may like a particular type of shoe and would want to wear it, but they may not be the best type of shoe for our feet, you know. So especially, you know, make sure something has nice support, you know, and just to to help balance.
And
that
how
as
many
well.
times have we seen on TV that the woman is putting her foot into a much smaller size because she wants to show off or whatever? Yeah, and it's rough for people too, especially now that we're getting into fall, winter here at Heart and Health. This is where we see all sorts of problems. Missteps, you can misstep, twist your foot, toes banging into something, snow, ice. It's definitely our busy time of the year. Are there any type of recommendations you can give for people for foot care during the fall and winter months?
Well, pretty much the same basic, of course, monitor your feet. Be careful with, especially with black ice. Be very careful because sometimes, you may not notice, to slip, be very mindful of the type of shoes you're wearing, something with a good either sole, good rubber sole, nothing that's going to easily help you to slide. Just be very mindful of your feet. And of course, some patients, they tend to get colder, wear nice socks, something, either wool socks if you tend to get very cold, or of course, if you sweat a lot, I always tell patients to wear like either cotton socks, something breathable that will allow it to kind of disperse.
Right, and again, go back to women with the nylons and the non-breathables and stuff like that. And of course, one of the top culprits has to be high heels. Now, one time I remember we were talking, you said that women can actually develop this thing with their foot from wearing high heels too much, or it does something to the foot?
Yeah, so what happens is sometimes with people who wear chronic high heels, that actually can tighten the Achilles tendon. So because the Achilles tendon is not getting planted right, getting to the ground, so sometimes that can cause a tightening of the Achilles tendon, and then of course lead to fasciitis and other things as well. So of course, stretching would be very important. Not wearing high heels consistently, try to do a mixture. Sometimes you just have to wear high heels for work, to try to, and have to be expected to dress a certain way, of course, but during those off times to try to be mindful of stretching and not always consistently being in high heels. And, if you do get tightening, either go to physical therapy or something that will help, getting that Achilles tendon loose again.
The other culprit that we see during the spring and summertime is the sandals and flat shoes, where your foot has basically no protection and it's just out there, just waiting for something to happen to it. And what's the recommendation for that? Because on the beach or whatever like that?
I always tell patients not to really walk around barefoot on the beach because a lot of things get hidden in the sand. I've had people tell me, "Oh, I found a needle in the in the sand." So I would say, especially of course our diabetic patients, sandals are a little tricky for diabetics because it's preferable that they wear something that encompasses and covers their feet because you want that extra protection, because especially those with neuropathy and those with poor circulation, because as we know, diabetes is a multi-organ disease. It can affect your circulation as well as your neurological. So you want to make sure that not to give opportunity for things to get caught in your shoe, get caught in your feet, or to get cut or bang into things. To give that extra protection is always important.
And also, I remember cases of things getting stuck between the toes when people were out and things got jammed in there, and that's probably a real painful spot to have anything in there.
Yes, it is. I've had things, to dig certain things out of in between the toes of patients as well. So of course, those who are neuropathic, to have just diabetic neuropathy, you want to be, because they can't feel, and sometimes it's harder to inspect, to bend over to really inspect in between each and every toe. I always tell the patients also, after you shower, dry in between your toes, just do that manual, just to make sure nothing is in between, make sure you keep it nice and dry and nice and clean as well. So it's very, very important.
Well, I wanted to thank you, Dr. Hanson, for visiting with us and letting us know about foot care and what we should do. And if anybody's having problems with their feet, you might want to see your podiatrist. Because do you need to take care of your feet? Because without your feet, you're not going anywhere. Until next time, I'm Larry Mike, and we'll talk to you soon.